Hello, hello. It's been a while since I've jumped on for the sake of jumping on, but one of the benefits about being a person who writes books about essential oils is you do get sent quite a lot of books about essential oils, and I was sent the most beautiful one in May, and then I was working on workshops, and I didn't have the chance to give it the attention that it deserved. So I wanted to show you this lovely book by my lovely friend Madeleine Kerkhof, and it's called Clinical Aromatherapy. And it's a very special book to me because we can see her husband Case in hospital here, and this presumably took place just after I had last seen her. We'd been on a conference together in Budapest, and I think we'd only been home about 3 days, and poor Keith took a terrible turn for the worst, and things were looking very grim for him. And luckily, the power of prayer and meditation and the power of essential oils and tremendous doctors means that he is still with us. And we have a lovely story to tell about his success back to health. And this book is just phenomenal. Madeleine, you should be so proud, I have to say. So anybody who is thinking about using essential oils in clinical practice needs to get this book. So other ones that she's done have been more specific to CO2s and more to do with, like, I feel, hospital practice, but this is absolutely fantastic for anybody who wants to just use essential oils for physical healing. But what's beautiful about it is that it has involved lots of other clever aromatherapists. I shouldn't say clever aromatherapists because I'm one of them. Sounds like I'm tooting my horn, but she asked lots of other gifted aromatherapists to talk about specific oils, and she asked me to talk about Melissa, so my write up on Melissa is in there. But also she specifically said, I want you to speak to your heart, from your heart, about what the oil does. How does it make you feel? And so there's this beautiful balance in this book between tremendous science. I mean, it's really well written in terms of clinical evidence for different things things can do. In terms of chemistry, each essential oil is broken down to say there's a lot of this particular constituent, and this particular constituent is, can do such and such. And also what I love as well is there's a great section on different carrier oils, which there is quite a lot written about carrier oils, but it's disparate in different books. So the way that she's brought it all together in this book, so that you can look and you can say, right, I want to make a treatment for such and such. She's gone and she said, right, this essential oil, this CO2, this carrier oil. So that makes it very different from anything else on in the marketplace. What I think is also tremendous is it's very current. The nature of our industry is it goes out of date very quickly. So there's a lot of things that perhaps I have written way back in 2015. I think, oh, actually, we know a lot more about that oil. I wish I'd written that. Or actually, there was that concern and that's been debunked now. So having current evidence is very useful, but also just understanding how things develop is really good. What I also like about the fact about this book in particular is that it looks clinical. You know, if you were wanted to treat somebody and you had got somebody in hospital and you were like, I want to use some oils alongside the doctors sometimes can be quite negative about that, and for good reason, actually. You know, they want to be able to say, I don't want you to disturb my treatment plan. This is my treatment plan. And so I don't really know that much about what you want to do, and there might be contraindications. This gives a really good guideline that you can hand over to a doctor and say, I want to do this, and this is the reasons why. And because it's set out so clinically, it's a really, really good textbook. It's also very nice to look at. And funnily enough, helichrysum. I mean, I didn't do it on purpose, but I've opened it on helichrysum, one of my favourite oils, and there's a bee on it. Well done, Madeleine. I like to see the odd bee or 50 in each book. But yeah, there's lots of stuff about end of life care. You know, it's not really written about enough, and there's some tremendous people who are really working on you know, in that part of like palliative care and stuff, which is taught in workshops. Fantastic. But for somebody like me, who I don't think I would ever want to go and learn palliative care as like something I would want to do in my job. I'm not a death person, really. I have interest in other areas, but it's extremely useful. Sooner or later, somebody in my house is going to sadly die. And to have this at my fingertips to say, well, this is really helpful, is really good. But also, there's lots of people who are newly qualified and who are doing volunteer work in places like hospice. So to have this kind of information at your fingertips is just fantastic. So I would say to anybody who is training to be an aromatherapist, or anybody who works in a clinical setting, you need this book. You do need this book. I wanted to say many congratulations, Madeleine. Thank you for sending it. See you soon.